presentation with the coordinator of the New York City Peer and Community Health Worker Workforce Consortium, Aviva Cohen, if you want to advance one more slide. We'll be talking about the toolkit that they've developed for the workforce integration of peer and community health workers. There's a lot of work that they've done on this. She will talk a little bit about the toolkit, a little bit about the efforts that are underway now to look at best practices in providing peer support services in a variety of organizations. And I've just had the benefit of working with Aviva over the past year on not only this series, but a number of different initiatives that New York City has had underway. With that, I will hand the ball over to Aviva.
Sorry about that. So yeah, we were just talking about how we can address the increasingly diverse needs of organizations by really having this customized approach to a toolkit. If we can just advance. Move on. Rita, I'll let you handle this one. This is your expertise.
Right. So if you have questions or comments that you'd like to make during the presentation, there is a chat feature within WebEx. Little bubbles at the bottom of your screen. The bubble looks like a speech bubble. That's the chat icon. So if you click on that and you get a little box that pops up, make sure that you click it to everyone. There's a drop-down menu that lists everybody that's in the presentation. And if you want to comment everyone, then click everyone. And we will take questions at the end through the chat function, and we will certainly, as we go through, I'm going to have to rely on Chris at this point because we can't see the chat from our location. So Chris, as you see things come up in the chat, if there's a question that Aviva should address, then we'll rely on you to do that. Thank you. Okay.
Will do. Thank you.
Onward, Aviva.
All right. So we wanted to get a sense also, just I know there's probably some familiarity from some of you, and others might be hearing about this toolkit for the first time. So we wanted to see just, who is familiar with the toolkit. So if we could just click and get a sense of who has even heard of the toolkit. And I encourage you, if possible, to type this in. You can say me in the chat box, just to get a sense of how many have really heard of it, how many have possibly. We'll start with this. Who's heard of the toolkit? You can just indicate. So we've had a few people, I see.
So Aviva, you can see the chat box.
I can, yes.
Okay, perfect.
Yep. All right. And so also, if anyone's maybe just opened up Toolkit and not yet really had an opportunity to go through the whole thing, yeah, a few people, perhaps. And has anyone actually looked at the full assessment and gone through the whole process? All right, and I see that we have some questions about where to access the toolkit, and we'll certainly provide all of that information as well. Yeah, so that helps me understand, how we can sort of place the emphasis right now on some of the background, so we can move on.
And Aviva, I'm sorry, this is Chris. Sorry to interrupt you again. I can take a look at the chat box so you can focus on your slides. If there's a question, I'll let you know. Okay?
Sure, thank you.
You got it.
So I just want to give everyone sort of a sense of who we are when I say we and refer to ourselves in this creation of this toolkit. So the Consortium is a group here at DOHMH, Department of Health and Mental Hygiene. And we were formed in response to a need that was identified by a group of individuals who were addressing the workforce, the behavioral health workforce. And there was a breakout group at a summit that was really intended to identify some of the needs and gaps in terms of peer support. And the recommendation of that group was to have a more centralized and sort of a centralized leadership body to be able to really engage people and get a sense even of what's out there. So really understanding what some of the practices are and some of the current status of understanding about the peer roles and really being able to increase the capacity of the workforce to support peers in their roles. So a lot of this really had to be essentially first understanding what is out there now, and we can advance and really looking at some of the landscape of the peer workforce. So we had a few different sources of information. We had a couple of surveys sent out. We sent one survey to provider organizations. So a lot of the respondents were administrators or managers or supervisors or other employees in leadership positions at these organizations. And we also sent one to those who were peers working in the role. And I just want to clarify for a moment as well that we started out really thinking about peers in a broad sense, looking at 5 particular types of peers, looking at youth peer advocates, family support. We looked at substance use, so the SERPA role. We also were community health workers. So we really had more of a broad vision in trying to think about what's out there and how there were some elements that were shared and common and others that were very unique. And so we also then met with several programs and tried to understand what was going on. So what they were doing at present, what they would like to do, where some of the gaps were. We can move to the next. So this helped us really think about what the picture was, what we were trying to address. And some of the areas that we got data on and really looked at were the training needs, the types of tasks that were being assigned, and whether they were really in alignment with the intended purpose of the peer role, and how individuals felt at their jobs, whether this was something that could provide some opportunity to move up within the role and provide an opportunity to learn more and receive training, thinking from both perspectives. So really kind of looking at this and seeing where some of the discrepancies may have been in the data. So a lot of this was about, for example, we heard from many of the provider organization survey respondents that they really felt that having the cell phone for all employees was very important to the role, and yet that was something that was less of a response from the perspective of those working in the role. So really thinking about what things were important and where some breakdown in communication. Okay. And so based on all of that information, and again, some of those gaps and similarities, so we looked at 9 particular areas, and we were able to really think about those categories essentially as drivers of workforce integration. And what we are really referring to when we say workforce integration is the ability to bring people in a sort of complementary way. So it's not about just blurring the lines or, everyone working together as a sort of a little bit of this and a little bit of that, but really understanding the unique roles that team members are bringing to the organization, including the value of lived experience. And so we wanted to really look at, even for organizations who hadn't yet started the process, recruitment and some of the areas there that might be needing a little bit of strengthening, for example, how to find that target audience, how to write a job description that clearly defines the role. So these are those 9 areas, and I'll give a couple examples now of some of the more specific practices within some of these areas. Okay. So these are just 2 of those 9, and one, for example, in career advancement opportunities, we really wanted to encourage organizations to provide that opportunity by creating positions for individuals who are in that role, because what we see a lot is that it's sort of a dead end for many peers, and there's this level peer position, and then many people often will go off and do something else because there's not an opportunity for growth, or it's very frustrating to feel that there's not really that appreciation where you're seeing other roles advance and become supervisors or higher paid positions. And so we really encouraged that. And we also wanted to, and this sort of fits in with supervision as well, one of the other domains, but we really wanted to encourage the opportunity for training in a way that is relevant to the person. So figuring out what someone's goals are in the workforce and really where they hope to see themselves, and putting that into the opportunity presented. And with finances as well, that was actually one of the most frequently identified barriers by providers in their survey responses. So when we asked about what's getting in the way of expanding, if you would like to, that was definitely an issue, was fiscal resources. And so that's really important to think about. But also these 2 particular practices, we wanted to emphasize, the ideas of equity and realizing that, of course, organizations vary between themselves, but within an organization, some are higher paying, some are lower paying, but recognizing that at a lower paying organization, a peer should be no more lower paid, so that we want to show that there's that understanding of the value that peers are bringing. And of course, Medicaid reimbursement is a critical part for many programs in understanding the return on investment of this particular workforce sector and how that can really benefit them. So we want them to be familiar with the practices and ready to go in that way. All right. And so this is really, I'd say, the big picture of where we looked at the implications for this toolkit in the context of changes that are going on right now in the healthcare environment. And so thinking even just about the growing size of the peer workforce. And it's certainly getting larger. We're seeing many more peers say that there are jobs available and many more organizations saying that they are hiring peers. There was a significant increase since our initial survey as well, where there were only 47% of those organizations saying that they were currently employing peers. So now at this point, we've collected some data, all of the anonymous data grouped together from the toolkit responses, and it's over 77%. So that's a pretty significant increase. And looking also at, it's not just about the size, but thinking about the types of organizations that are recognizing where peers can fit into their support that they're delivering. So thinking about how peers can really not just, they don't have to be limited to clinical settings, but are really bringing something to the support delivered in criminal justice settings, in housing, all different types of organizations. And as that's happening, we're also recognizing that there's increasing diversity in the needs of organizations. So one program might be more familiar with this idea and one might be less, and given that their services that they're delivering are so different, there's just a whole host of things that need to be considered. Okay. And so when we think about that, we really share this across organizations is to be able to address the needs of organizations in a way that is supportive and that really helps the organization understand its own needs. And so this tool that we created was really looking at those consistent 9 domains, but recognizing that they will manifest differently in all organizations, and the needs to improve certain areas will look very different across these organizations. So it's really important that an organization have the understanding of their needs and also have the resources to address them in the way that's most appropriate. All right. And so the way that we're doing that is by building in this self-assessment for organizations, and that's a piece of the toolkit. So that's what someone who accesses the toolkit will first see, really allowing the organization to think about practices within those 9 domains. So it goes through these practices that are recommended, and then really reviewing it and helping them understand what areas can be improved upon. So thinking about the results, and also with the opportunity to download a PDF at the conclusion of the assessment. It really is helpful for organizations to have access to that at a later point and see how their practices may have changed over time. And really, also, I mean, this is, so you'll see how this works. It's an automated customization in a sense. And so after the submission of those responses, one organization who submitted certain responses will see something very different from another. The resources are automatically displayed according to those responses of the assessment. And I know this might sound a bit confusing, but we will see it in real time and get a sense of how this works and how it is customized. So we can move on. And really the process of the self-assessment, we get questions about this a lot. In fact, how does this work? How do we do it as a group? How should we do it? And again, this is something that can really look different across organizations, but you see the process of completing the self-assessment as a collaborative and beneficial process that is sort of the very nature of the integration that we're trying to promote for an organization. So thinking even about the message that this sends to an organization's employees, saying, we value your opinions and your input. This is the start. This is where we want to know what all employees are experiencing in this workplace. And thinking even about how even within an organization, different departments, different roles often function in what we often refer to as silos, or little a bit of a intradisciplinary tunnel vision, as I call it, but really having a sense of what the person right next to you might be doing for the same person that you're both working to support. It really helps bring people together and think about where there are some shared perspectives and where there might not be, but really helping to understand that this is an opportunity to actively promote this integration and think about really bringing it back to that person-centered approach where we're all coming from different perspectives, but for the same person. And it's, you know, I think really that can often get lost in breaking down the roles that are within a work. And when we think about this, some of the challenges, I mean, this process might not always be pretty. You know, it might really highlight some of the issues in real time that need to be addressed when going through the assessment and trying to involve others throughout the organization, thinking about where there might be conflict. It's really an opportunity to start focusing in on some of those areas and seeing how they manifest in more than one way. All right. And so with that, I do want to give a little look at the toolkit itself and how this can work. So we can open that up. And this is what you will see when you go to the link that is online. And if you scroll down, you see complete the online assessment. So it gives you a little view of what the toolkit is, and then we can move on to actually doing it. So can we all see, because I know it's a little bit, yeah, if we can make it maybe even a little full screen of them. So as long as, I mean, you do have to scroll a little bit, so that'll happen, but okay, let's see if we can get a fuller view of this somehow. Or maybe make it smaller, or that's cool. All right, we can start this assessment. So this is the beginning of the toolkit. When you open it up, you're going to see, again, the overview that we just kind of discussed. So just to note that this is done using Qualtrics Software, and this also allows us to have the opportunity to, once a certain response is given in the beginning, to tailor the questions that appear. So if we move on, I'll show you, there's a question in the very beginning even about, here we go, has your organization ever recruited or attempted to recruit peers? So if someone says no, there are a few questions that will then not appear later because we know that they're not at that point of having workplace experience of working with the peers. We can say yes here. Let's go with that. All right. And I'll let you decide what responses to give, but just, you know, thinking about how difficult it might be to do that. Pick any, you know. We'll try to think. And you know, another thing to think of is the selected responses are actually what then informs the content. So if we are saying everything's extremely easy, we might not see that much at the end. And so that's part of this section on recruitment, again, thinking about interviewers and their understanding of questions that might be used to evaluate competency. And we want to make sure that interviewers are prepared to do this and to bring in the people, but in a way that is really respectful and understanding of the role. So even thinking about basic guidelines around lived experience and how that's so key to and central to the role, but in an interview process, not being able to really explicitly say what's your disability, you know, given that that's against the law, you know, but really engaging the person in a discussion and saying what's been meaningful to you in your life that makes you feel that this is a good fit, you know, really finding other ways to approach that. So there's also sometimes concerns raised about benefits and the timing of the number of hours that are worked. So we want to make sure that interviewers understand that as well, to be able to respond to those concerns. So job descriptions, very, very critical, as it also reflects the expectations on the part of the organization, but also the person who is applying for the job. So we want to make sure that these components are part of the job description. And you may notice that these tend to be best practices across the board, but we really want to emphasize that this is especially important for peers in that it's often been overlooked and it's often been, there's an increased vulnerability given that peers have faced a long history in the workforce of being undervalued and not really understood for the value and purpose that they bring to the workforce. So there's a real need to make sure that these are in place. So this is about attitudes and beliefs, thinking about how the culture of the workplace and other employees are approaching. So is there sort of this exclusive attitude? Does it, you know, do peers still look down upon? again, this is really helpful to get multiple perspectives on within an organization. We really want to make sure that people reflecting diverse perspectives, but also in a way that they can be open about and kind of look at as a bigger picture. So thinking about diversity and issues that come up and, in any workplace and really need to be addressed, but that are critical to all groups, and really thinking about what's being done about it, not just are they aware, but do they understand how this might come up also? For example, even with youth, there's been a lot of concern about ageism and assumptions that are made, or individuals who are returning after incarceration or have some criminal justice involvement, thinking about how that looks. So thinking again, as we mentioned, this was the example that was provided on the slide, looking at equity in terms of pay, thinking about the standards of Medicaid billing and reimbursement, practical, but critical for an organization to have in place. And is this part of the budget? Because really assume that this is going to happen if it hasn't been worked into the larger sort of scheme of things is not fair to anyone. So not fair to the organization or the peers who are looking to be employed there. Thinking also about basic role clarity. So how much of an understanding do other employees actually have about the peer role? And how much opportunity are they given to learn more? Is this something that is addressed by the organization? And then thinking about how they're involved in projects. So if there's something that's really a widespread initiative and peers are not allowed to go because they have to go do their peer work at that time, and the schedules are not adapted accordingly, that's extremely problematic and really sends a message. And think, as again, with so much also integrated care in different models where we're looking at team-based approaches, it's really important to think where the peer fits into those workflows. And it's something that's really being improved in many instances, but it's especially important to think where each role, including peers, would fit into providing those services. And again, this is the career advancement piece that we looked at a bit. So thinking, are those opportunities available? And they should, if so, then paid accordingly. This you probably recognize from that earlier slide as well, the training opportunities. And again, this points to that issue of scheduling and really those little things that make a big difference. So making this supervision, which is actually a very commonly expressed concern in terms of who's providing supervision, if it's being provided, how much, how supportive is it. Really making sure that there's an understanding of that line to be drawn between a clinical role versus a supervisor's role. There's often some concern, if this person's very sensitive or has issues, the things that really are not in a supervisor's sort of realm of responsibility, and also make assumptions about the career role and about the recovery process. Let's see. So just thinking about orientation and onboarding and making sure that the basics are covered, that we have access to workspace and supplies and materials and understand what to expect. These are some things that really should be presented in terms of information. And this is the last subsection, the last domain about program monitoring and evaluation. Making sure that things are working, but in a way that is actually meaningful and incorporates all of these different perspectives. Does it look at all employees back when looking at a satisfaction survey, for example? And similarly important, does it look at the feedback from service recipients? Perhaps seeing all of a sudden that there's a great increase in the feeling of being understood and feeling like someone is reaching out to you and cares about your goals. So that's really helpful for an organization to see and linked to the peer support. There we go. So now we can continue for our customized toolkit, which will look very different if I were to put in excellent all of those responses. So here are the resources that would be provided, and these are really specific. And we don't necessarily go through all of these resources. We can look at sort of how these are reflecting, because I know there was sort of a consistent bad responses we put, or area of improvement across these domains. So you'll see a lot of these here. But it's a collection essentially of these of information that can address the areas where gaps were noted. So we can look through a few of these, and again, looking at the job description. So given that we didn't include those in the job description, this will sort of help an organization to address that and not just say, well, here's where our problems are, really to think about what can be done. And again, a lot of this is not necessarily going to be the complete look at this for an organization, but we're really seeing it as essentially a tool in the toolkit. So thinking about how it can start the conversation and really even look into more specific needs within an organization. So, maybe we're putting clear descriptions sometimes for positions, but not for peers. So maybe we can, X, Y, or Z and review this by this time and have this many different working peers review our job description and really starting to brainstorm and think about these issues where they come up. These are just some very clear guidelines that if they're not familiar with the regulations around interview process provided. So yeah, you'll see many, and some of these are also sort of collections of resources. So here are some very interview questions that can help address the competence areas that were mentioned. And looking at the clarity of the role. And you'll see also a lot of these do overlap. So a lot of the domains really impact one another. Thinking about how role clarity in a job description is also reflected in the actual understanding that other employees hold of the role itself, where they fit into the work.
Hi, Aviva. This is Chris. Hi. We have a quick question. Do you prefer that I pose the question to you now, or do you want me to wait to the end? You can probably chat box.
We can begin that, I believe. Yeah.
Ask.
Sure.
Sorry. Okay. So it's a question that says, I was wondering, after the assessment is complete and the organization is moving forward to hire a full-time peer mentor, is there a recommended training to become a certified peer mentor? I wasn't sure if the NewYorkPeerSpecialist.org site is the only available certification training available. So is there another training avenue besides that website is the question, it sounds like.
And I'm actually going to turn that one over to Rita, who is, again, very familiar with all of the specific trainings available, but also, understands that there are different types of certifications. So just be clear with that.
Sure, I can address that, and it really all depends on the employer and the funding stream. There are certain certifications that are required in order for the funding for some peers. So if it's Medicaid billable, then the certified peer specialist in New York State is required in order to be hired into that position, or at least at the provisional level. Or if it's through OASIS funding, then I think the CERPA is a required certification for peers. If it's not through the funding mechanism, there's a lot of peer-run organizations. There's a lot of organizations that don't have that as a requirement. There's a lot of wonderful training programs, and right in New York City, there's Howie the Harp, which is great. You can basically take any you want to, but in order to get certified, you can just take the tests on the Academy site if you're a mental health peer support specialist or peer specialist. Take the test for the OASIS training. I think it's the anyway, for the CERPA certification. You can take any training you want to, but you need to test to complete the certification. That's a short answer, and I would defer to the certification board for something more specific.
Thank you, Rita.
Thanks, Rita. Aviva, we do have one more question. says, this is a good question. Do all supervisors who hire peers get training on how to supervise peers?
Oh, interesting. And
Very good
unfortunately,
question.
no. That's a great question, and I wish that the answer were yes. And there are more supervisor-oriented trainings now available, thanks to many of the training programs. But again, we really think that that is an area that needs to be more emphasized across the workforce, thinking about some of the implications that are specific to the peer supervisory relationship. So no is the short answer to that.
Great, thank you.
Sure. Do you have any other questions?
Yeah, sorry, Viva.
Oh, no.
Yeah, there is one more. It says, so many peer roles require New York State certification, but many struggle with contacting the certification board and communicating around their certification. Are there any suggestions on how to best connect with them?
Yeah, I know there can be a lot of confusion often, especially with so many recent changes. And I think that many having sort of centralized options, so whether if it's someone that is already employed, certainly supervisor or employing organization should really be able to help facilitate that process, but also the training programs should be a good kind of contact point if there's trouble understanding, how to best get in touch, really connecting through those who've provided that support. That can kind of be a way to connect and a liaison essentially to the certification process.
I can jump to Aviva because there was turnover at the certification board, and there was about a 4-month gap in time where there wasn't anybody dedicated to being able to answer those questions. We now have Tyrone Garrett, who is wonderful, and he has taken on that role again. So people are getting answers to questions much more quickly, and the turnaround for certification and recertification is happening much more quickly as well. And in case any of you don't know, Joe Swinford, who used to be the Deputy Director for the Office of Consumer Affairs, is now the manager of the certification board, so I imagine they're going to be going much more smoothly over there from this point forward.
Thank you.
Aviva, we do have a couple of questions. I don't know if you want
Sure.
to, if you want to hold off or.
No, I think we can go with those.
Okay. Let's see. It says for CRPA, you need 500 hours of experience. For mental health, you do not. When will there be a combined certification parity of effort? Should not there be an in-person assessment? Should there be an in-person assessment for that?
So I see a few things raised there. I mean, it's my understanding that there's divisional, or there are two different types essentially for the mental health peer. I'm getting, correct me if I'm wrong, please, but that there's essentially who do have that work experience, and then prior to that, the provisional certification. So I know that there is some similarity there in terms of needing some work experience. I don't know, honestly, when if there will be a combined training. I know that in terms of the trainings are distinct, but I know there are also many training opportunities where there's overlap and opportunity to look at the larger behavioral health workforce. So, yeah, honestly, as the consortium, we don't necessarily have a direct role in providing those trainings for the peers themselves. We really have been focusing more in the realm of the organizational side of things. So, yeah.
Jump in again one more time. Sorry, guys. I keep jumping all over you, but I don't mean to. The next Faces and Places of Support webinar, which is not going to be in August. We're going to be skipping the month of August. But on September 27th, we will be doing a webinar on the SERPA, CPS, what the distinctions are between the two. I don't ever see that there will be a combined certification because they're dealing with separate issues. But I do see that a lot of people are getting both certifications, and that's really the ideal if you're working with a combined population. So Ruth Riddick and I are going to be doing that webinar, and we're looking at this point, if anybody on the line has both of those certifications and is using it in work, we're looking for people to tell their stories about how they're using what they've learned in each of the two different disciplines. Thanks. I'm sorry for jumping in again.
Thank you so much, Rita.
And Aviva, we've opened up the floodgates for questions.
All right.
So I have a couple more.
Sure.
Will there be future trainings for supervisors who supervise peers?
So again, I sure hope so.
Yeah, me too.
But, and I think there has been movement towards that. Yeah. So I know that I think even APS has a couple oriented towards supervisors. Is that correct? Or Rita?
Yes, we do, and the certification board on the mental health side is looking right now at what the requirements in the Academy of Peer Services will be, because they want supervisors to have exposure to what the peer role is and what peer support is all about. So they're looking at whether they want supervisors to take the entire core set of core courses, 13 core courses, if there's a subset of that. That's something the certification board is looking at right now, and we at the Academy are just waiting for their decision as to whether they want courses or an adaptation of those courses. So we are actively working on that on the mental health side, and I believe that there's similar movement on the OASIS side.
Thank you. And one thing that we've also been really emphasizing, again, pointing to that overlap in those domains that we look at, we really also think that this is an opportunity for that career advancement to play out in the supervisory role. So if individuals have really been doing a great job and really been in an organization as a peer for quite some time, really then being able to advance and provide that leadership and provide that support and supervision to newer peers who are coming into the role. And so that's the sort of thing that, as the consortium, that we would really help organizations to figure out and think about in setting up an environment within the workplace that can really emphasize those principles and make sure that those areas of integration are in place, create some opportunity for growth.
Viva, and I just wanted to point out that we had 1 o'clock as our end point, but the way that we usually do our Faces and Places webinars is that we do the presentation for 45 minutes, and then we have the presenter, if they're available, stay on the line for half an hour to do questions and answers. So for those of you who still have questions and answers and want to continue to speak with Aviva, you can hang on the line. I realize we're at the end of our presentation time right now. So Aviva, can you stay?
Absolutely.
Okay, so we'll keep going until we run out of questions or we run out of webinar space, whichever comes first.
Thanks, Aviva. Thanks, Rita.
Thank you.
We do have some questions coming up here at the remote site, so let me just come on over and speak into the microphone.
Hi, Avita, this is Lauren. I just had a question in terms of the toolkit when you mentioned having employees at an organization take it. If someone, let's say, is not involved in the hiring process or interviewing, when they take the toolkit, would you suggest they just pick kind of the middle of the road answer if it's an area that they're not directly involved, but trying to feedback?
Yeah, so I do think that that's actually an excellent question. And again, we tried to phrase it in a way that was sort of to the best of your knowledge. So are interviewers at your organization, aware? And yeah, we understand that that might not be an area that you necessarily can speak to if you're not aware of their awareness, but really just based on feedback, based on each person's experience. And I think that's actually why it's so important to have those varied perspectives, because you see a general trend, towards a particular answer, that's significant as well. So understanding that there might be people less aware of these individuals, but really just kind of getting the sense of what the organization as a whole views that situation to be.
Great, thank you.
Sure.
And Aviva, I've asked before, but I'd love to hear the answer again for the folks who are on the line now. This was developed primarily for New York City providers and organizations, but will it transcend that to some of the upstate and rural areas and even beyond New York State?
Sure. So absolutely. So there is some information within the toolkit that is specific in terms of the process of certification or some of the more location-based, so issues like Medicaid reimbursement might be somewhat different, but, really even just thinking, and not if we're talking about the state, then that's not as relevant in terms of the city-by-city differences, but thinking, across even nationally, there might be differences there. But yes, it's absolutely, certainly transferable to other states, other cities, and recognizing that practices might look very different across these different regions, and the needs are also going to be very different, and we hope that the nature of the toolkit actually helps to support that and really look at individual organizations' needs.
The Regional Planning Consortium at one point talking about doing learning communities and learning collaboratives in relation to the toolkit. Is there any movement towards that down in New York City right now?
So we haven't really done that as we are looking actually. Oh, sorry, I'm going to, for a moment. All right, so, okay, so there's been actually a lot of emphasis now. What we're trying to start is looking at providing, sort of as a pilot, but providing some organizational training. So looking at these specific areas that would really be initiated by completing the assessment and assessing where an organization's needs are and really looking at perhaps 3 of those 9 domains in particular. So we were developing actually at first it was sort of a technical assistance approach, but we're looking at it more specifically as sort of a manualized, brief but intensive program for organizations. And we are also very interested in hearing from organizations who might find that to be a good fit, who might really benefit from something like that, and trying to find a good match for this pilot. So looking at really guiding them through the process in multiple ways, so really addressing the needs of an organization, whether it's about we really need face-to-face training, we really need it online, we need more just materials, or thinking about how these core principles can be adapted and strengthening them within an organization.
Thank you.
You can answer this as well. I just had a question. How does this relate to the integration and the stages of change toolkit on the OASIS website?
She was asking about how this relates to the stages of change toolkit on the OASIS side.
Sure. So we're certainly very familiar with that toolkit and with the great work that's been done in terms of OASIS and their emphasis on implementation. So that toolkit is specific, I believe, to the substance use and recovery area of things. So this is really more of a general overview from the organizational perspective, so not specific to one role or another.
Okay. So
and again, you might see some overlap.
Like mental health and substance abuse then.
Yeah, actually, this would cover youth, family advocates, mental health. So it's and health workers as well.
Is there one specific to mental health services?
You mean a toolkit like this?
Not that is state-specific, actually, at this point, I don't believe. There are some nationally that are excellent.
Yeah, I saw Wisconsin had an interesting employer toolkit that they had done recently. It was like 2 years old. I saw a pilot of that recently.
Mm-hmm. And I know that Philadelphia, the city of Philadelphia, had a really excellent one as well.